Good morning. Consider this. While we sit here at our desk this morning, drinking coffee and logging onto webinars, 33% of homeless high school students haven't eaten breakfast in a week. 42% got less than 4 hours of sleep last night, and 41% of homeless high school students struggled with depression. Roughly 1.3 million students are homeless in the United States, including over 100,000 students in New York City. In other words, hundreds of thousands of children across America are not only homeless, but hungry, tired, scared, and depressed. And this is just the tip of the iceberg for these students. I'm Jennifer Erb-Downward, Principal Policy Analyst for the Institute for Children, Poverty, and Homelessness. And today we're talking about the health and well-being of homeless high school students, as discussed in our recent report, More Than a Place to Sleep. When we talk about the challenges faced by homeless families and students, we often focus on where they will live, where they will sleep, what job they can acquire, and what education they need. Our findings in this new report suggest that we absolutely must also focus on the physical and mental health risks and barriers for homeless students. I will also show you a new interactive tool that will allow you to more fully engage with the health data and hopefully will continue to deepen the conversation on how best to support students experiencing homelessness. All of our reports and interactive tools are available for free on our website, ICPHUSA.org. Before we begin, for those of you who are not familiar with us, the Institute for Children, Poverty, and Homelessness is a policy research organization that focuses on family homelessness in New York City and throughout the United States. Our goal is to provide policymakers, elected officials, advocates, and community members with information that will further data-driven decision-making about the factors affecting family and child homelessness. On a technical note, you should see a window on the right side of your screen if you're using a desktop computer. Please feel free to type in any questions that you have along the way, and Katie and I will do our best to get to them all. Also, we have over 500 people registered for today's webinar, which is very exciting. But if you experience any slowness on our website or the data tool as a result of the large number of people registered, please try logging in again at a later time. This chart represents 16 major data points from our recent report, which is based on data collected by the Center for Disease Control's Youth Risk and Behavior Survey. Take a minute here to look at the graphic. The YRBS is a national survey conducted every other year by the CDC since 1990. For the first time in 2015, New York City added questions around housing. The addition of these questions enabled us to look at health outcomes and risk behaviors of homeless teens in New York City in comparison to their housed peers. If you're not in New York City, we encourage you to look into whether your state or city opted to include these important questions around housing and homelessness. If so, what's being done with the data? And if not, how can you push to have those questions included in the next survey? Now let's look at the data. We found that across every single health indicator, homeless students faced greater risks to both their immediate and long-term health and well-being than their housed peers. This can be seen in the differences between the blue and red bars, where red signifies the responses of homeless students surveyed, and blue the responses of housed students surveyed. This was particularly true when we looked at the physical risks that homeless high school students face. Here in this chart, we see that homeless teens experience 3 times the rate of sexual and physical violence in their dating relationships when compared to teens who are not homeless. Not only are their rates higher than their housed peers, but the data show that intimate partner violence was a common experience for homeless teens. 1/4 reported being deliberately hurt by an intimate partner, and 23% reported being forced to perform sexual acts. That is roughly 1 out of every 4 homeless teens. The physical risks for homeless teens were not limited to intimate partner violence. As this quote here shows, homeless teens reported frequently finding themselves in situations where they were exposed to alcohol and drugs, as well as other risks. Physical and sexual violence, substance abuse, and the day-to-day stress of homelessness take a toll on high school students' mental health. As a result, homeless teens faced higher rates of depression and were over 3 times more likely to attempt suicide than their housed peers. A shocking 1 out of every 5 homeless students attempted suicide in the prior 12 months. And this is critical to talk about. Given the chronic stress and trauma that homeless teens are facing, there's a great need to increase access to mental health and trauma-informed services in schools. While much of the data point to the challenges that homeless high school students are facing, they also point to opportunities. One of those opportunities is the potential that school-based health centers have for meeting the health needs of homeless students. This quote by a young man who was homeless during high school and faced numerous health challenges highlights how the lack of a stable place to call home can greatly interfere with getting appropriate medical care. More than that, though, it shows how stressful and demoralizing it can be for a teen when they do not have someone at school who believes them and who can listen to and address their health needs. School-based health centers can help to fill this gap. What this chart shows is that while homeless students overall who were surveyed have less access to school-based health centers, among those with access, they're more likely to use the centers than their housed peers. These charts and quotes highlight just a few of the many challenges to health and well-being that homeless high school students are facing. With that in mind, we're now going to talk about some of how this data can be used. And as a part of that, we're going to focus on our health data tool that we're launching today. To access our health data tool, you can go to our website, icphusa.org. From there, scroll over to our research tab and interactive data. When you click on the interactive data tab, it will take you to a page where we are going to be housing all of our interactive data tools. So you'll see our interactive map of student homelessness, which we discussed last month on a webinar, as well as our new health and well-being of homeless high school students data tool. You can click on this icon and then click Use the interactive tool, and a new tab will open in your browser. There are a number of different ways that this tool can be used, but today I thought we would highlight 3 different examples to get everyone started. So the first example I want to discuss is if you are from New York City and you're working in high schools and you think that perhaps students who are experiencing homelessness in your high school are being under-identified. Well, the YRBS data can help you to explore this question and whether or not this is an issue that should be discussed further at your high school, as well as in other high schools in New York City, in the following way. So first, you can go to our menu, you select the item housing status. Then from there, you select weighted data, and you'll see that the percentages changed slightly in the pie charts that we're looking at. And this is because the YRBS data can be used in order to estimate all of these health risks and behaviors for the population of high school students in New York City. And that's an established methodology that's used by the CDC in order to use this data to estimate what's going on citywide and in other states for your states. So when you select the weighted data, what you'll see is that in this pie chart on housing status, 11% of high school students in New York City are estimated to have experienced homelessness. So this would suggest that your hypothesis in your school, that you are correct, because on average, 6% of high school students are reported to be homeless in the administrative data for New York City. So this would suggest that this is a conversation that should be taking place and that it would be important to discuss with members of your high school team to figure out how you can better identify students in New York City, in your high school, who are experiencing homelessness. Below this chart, you could also look at the type of homelessness that students are experiencing. And what you'll notice here is that in addition to the percentage, so we have 28% of students who reported experiencing homelessness in the last 30 days who are not estranged from the family. So they did not report that they had either been kicked out or run away from home. But in addition to these numbers, you'll see that there is a number that is the estimate for the number of students who've experienced that. So here we see that 6,021 students are estimated to have experienced homelessness in the last 30 days in New York City high school. Another way that you could use this data is if you're not from New York City. So in this case, you would want to use the unweighted data or the raw survey responses. And one thing that makes New York City unique and this data useful in this way is that we have a large enough sample of students who experience homelessness to actually explore these indicators based on those students who responded, indicating that they were homeless, and those who responded to being housed without having to weight the data. So here you see that a total of 712 students indicated that they had experienced homelessness, and this was roughly 12% of the sample. From there, you can pick an indicator that is of interest in your community. So for this example, let's say that you are working in a community which is struggling with prescription pain medicine abuse. So you could select that indicator, which on the survey is use of prescription pain medicine, benzodiazepine, and or stimulants the last 12 months. And here you'll see two different pie charts appear. The red pie chart is for all homeless students, and the blue chart is for all housed students. And here you can see that 22% of homeless students reported that they had used prescription medication without a prescription in the last 12 months, compared to 6.6% of housed students. So homeless students really had roughly 3 times higher risk in this area. So here you might want to share this information with somebody that you're working with. And you could go over to this button here, and this will allow you to download the image of the chart. So you could save it to your desktop as a PNG file and use it in any kind of presentation. You could also do the same for the image for housed students. If you are more interested in the data itself rather than the pie charts, you could download the data tables by clicking this button on the left, and this data will open in a CSV file. Also, you would have the opportunity to explore this health indicator of use of prescription medications without a prescription by the type of homelessness that students experience. So again, we see that 6.6% of housed students reported using prescription pain medicine, benzodiazepine, and or stimulants in the last 12 months, compared to 22% of homeless students who were homeless in the last 30 days, but not estranged from their families, compared to 19% for homeless students who reported being unaccompanied, and 32% for students who reported that they both had been homeless in the last 30 days and at some point kicked out from their home. Again, you would have the option of downloading the table by clicking the button on the left, or saving this chart image as a PNG file. The last option that I wanted to discuss today is that you could use this data if you're from New York City and are trying to develop a health outreach program and are trying to figure out whether or not it is important to include homeless students specifically as a target group in this program. So say, for example, you are focused on addressing teen pregnancy in New York City. Well, you would, in this case, select the weighted button, as we did, and from the menu, select was pregnant or got someone pregnant in the last 12 months. From here, what you'll see is, again, two pie charts, the red representing all homeless students, the blue representing all housed students. And we see that 10.5% of homeless students reported that they either were pregnant or got someone pregnant in the last 12 months, compared to 0.792% of housed students. So homeless students definitely have a higher risk, but perhaps you want to know what proportion of all teen pregnancies involved homeless students. Well, this is a way that you could use the weighted data to answer that question. You could scroll over the pie that is for the homeless students who reported this risk, and you'll see again a number appear in between the percentage and the question response. That number is 1,686. So this is an estimate of the number of high school students in New York City who are homeless, who either were pregnant or got someone pregnant in the last 12 months. For house students, this number is 1,239. So if you wanted to know the total number of estimated pregnancies involving teens in the last 12 months, you could add these two numbers together. And then if you wanted to know the proportion of these pregnancies that involved homeless teens, you could divide the homeless number by the total number of pregnancies. When you did this, you'll find that 58% of all pregnancies, teen pregnancies in New York City, are estimated to involve a homeless teen. So this would be further support for your program that there is a critical need to be addressing and targeting homeless teens, particularly for any type of pregnancy prevention or outreach program that were being developed. Again, there are many other ways that we could use this data tool, but instead I want to open up our conversation for questions so that we can make sure that we're helping to make this tool as useful as possible to everyone on our webinar today.
Where did you get this data, and is it available for other cities and states?
Sure. We got this data from the CDC, and yes, it is available for all states, including a number of cities and municipalities. So in order to find out what data is available for your state, you can go to the CDC website, and it will indicate the kinds of questions that are asked in your state. And there also is a way that you can ask for help in terms of receiving access to the data. In some cases, the CDC can provide the data directly to you, and in other cases, you may have to go through your state health department.
We're receiving some questions about what definition of homelessness is being used here.
Sure. So there are two different definitions of homelessness that are being used. In the YRBS survey, they asked about the experience of homelessness in the last 30 days based on where a student usually lived. And so there are a number of different potential responses for that. But if a student was not usually living in the home of their parent or guardian, they were deemed to be homeless. The other question in there was whether or not a student had been kicked out or run away from home in the last 12 months. And for those students who reported experiencing that, that was also another way that they were deemed to be homeless.
Could you explain a little further the difference between the unweighted and weighted data? Is what geographical area is the unweighted data representative of?
Sure. So the unweighted data is not actually representative of any specific area. It is the raw survey responses that were taken in New York City. So the best way to think of it is that for any survey that is conducted, you always are going to need to keep in mind that it is more representative of the area where it was conducted, in this case, New York City. But the unweighted data, because we have a large enough sample here, can be useful as a sort of guiding tool for people who are outside of New York. If you are in New York, probably the weighted data would be better to use because that's really an estimate of what's going on in New York City overall. Whereas the unweighted data really is, you can think of it as you're looking at as a sample of homeless teens compared to non-homeless teens and what are their outcomes.
Did you do any statistical analysis on homelessness and intimate partner violence issue or homelessness and other issues to see if homelessness is correlated to violence?
So yes, in these cases, all of the data that we looked at were significant. So homelessness was definitely correlated with intimate partner violence. So not only was it more prevalent, but it was significantly more prevalent.
Why did you choose to do an app, and what parts of the app do you find to be most beneficial?
Sure. Well, the main thing that led us to do an app for this data is that we realized as we were going through the data that there was no way that we could possibly cover all of the questions that really needed to be covered in a single publication. And we also realized that there were different ways that people might want to use this information, and that if we really wanted to be able to have a conversation, and an ongoing conversation, both locally and nationally, about how we can really meet the needs of homeless students, we needed to make this data accessible so that people can use it to meet their own specific needs, and programmatically or policy-wise. So one thing that we're moving towards and continuing to move towards with our publications is to try to add to all of those publications interactive data that can be used in a more collaborative way.
What do you think the most important takeaways and policy implications are for elected officials?
The most important takeaway for elected officials is that homeless students are struggling, and in many different ways, academically and physically, socio-emotionally. There is a great need for programs to support homeless students, and that we need to think about homeless students' needs in a holistic way and really work to address these needs.
Why are absent from school and feeling unsafe together on the indicators? Are they necessarily the same?
So this is a question from the report, specifically just to clarify. One of the indicators that we looked at was absences from school and feeling unsafe. And this was actually a question in the YRBS survey, and I'll pull it up here, that looked at absences from school due to feeling unsafe. And so in this case, the way the question was asked, they were linked. So it was specifically whether or not students had missed school because of safety concerns. And you can see that here among homeless students in the unweighted data, 12.4% of all homeless students were reporting that they had missed school due to feeling unsafe, compared to 4% of housed students. And if you're interested in that specifically, for New York City, the differences are actually even a little bit larger when you look at the weighted data. But it's roughly 4 times the number of students reported missing school, homeless students reported missing school due to safety concerns.
I'm a principal in Brooklyn. How can I use this data to show my school board that homeless students in my district are struggling?
Sure, that's a great question, because as you may have noticed, the data here is not specific to geographic boroughs in New York City. However, this data can still be incredibly useful if you are working in a specific district or school in Brooklyn or the Bronx. What I would suggest in terms of how to use this data would be to think about what health issues are being addressed in your community and have been identified as priority issues. If you're not sure what issues those are, you can go to the health department website to look at some of the issues that have been broken out locally in terms of priority health issues. And there, from there, once you've identified those issues, you can use this tool here to look at the different options that exist in terms of data that's available. And then you can present the differences between homeless students and housed students for those indicators. So again, say, for example, your community is known to have a large problem with asthma. You could use this tool. The community is already addressing asthma, and you could use this tool to say, well, look, we also need to really meet the needs of homeless students who are struggling with asthma, because their asthma attack rates are actually higher than those of students who are housed. So if we're not meeting their needs, we're really not going to be fully addressing the problem. So that would be my suggestion for how to use this data on a very local level.
Do teens self-report as homeless, or are they identified as homeless by an external party? How many homeless teens can we assume are left out of this snapshot?
Sure. So in this case, this is a survey that is conducted, again, by the CDC. So this is self-report data. All of the responses are self-reported by the teens. So it is, these data are estimated based on those responses. In New York City, the education data is different. Those responses are taken by someone else. So someone at the school who is working with students would fill out or help to fill out that form. Obviously, a student in some way needs to self-identify. So there are many students who might not be identified, but there is more of a process of someone else being involved in that. I think the most striking thing in this data, though, is that there is a large difference between the estimated number of students who are experiencing homelessness in the YRBS, which was 11% for New York City, versus the number that's reported in the DOE data in New York City, which was 6%. So that can in part be due to the different definitions. The YRBS data is including experiences over the last 30 days. So there are different definitions, but it's an important consideration how we're making sure we meet the needs of some students who are very, very vulnerable.
Do you feel that the unweighted data is a good representation for the numbers of homeless students for the rest of New York State outside of New York City?
So the data, the unweighted data, what I would say about it is there's very little data right now about health outcomes for homeless students. And so it is a good guiding tool to think about the differences in the need between housed and homeless students. Now, whether or not you could say that in the unweighted data, for example, if we click asthma, whether you could say in New York State that 32% of students in New York State who are homeless had an asthma attack in the last 12 months. That's not something that I think is what the data is pointing to. The data in this case is really pointing to, if you're using the unweighted data, it's pointing to the disparity between homeless and housed students. So that's really more critical to think about, the gap in need between homeless and housed students, rather than the exact percentage if you're not using this data in New York City.
How often will you be putting out interactive features like this?
That's a great question. So our goal is to be continuing to put out interactive features with all of our reports. We see this happening in a number of different ways. We have, as I mentioned earlier, this tool that we're launching today, as well as our interactive map of student homelessness. We are planning on continuing to update these tools with new layers and new items. In addition, as we have new reports that require different tools to make this data more accessible and useful, we are planning on continuing to expand the kind of tools that we have.
What is the relationship between data from this survey and data for the student homelessness in New York City school districts, district by district breakdowns?
Sure. So the relationship is that they both include homeless students and housed students who are going to school in New York City in 2015. So you're talking about a similar group of students. When you use the weighted data, the data has been weighted to be representative by age and race and student population to all of New York City. From there, they are different ways of counting students, but I would say that these data here provide insight into the health struggles and challenges that students in New York City who are homeless are facing.
Why do you have information only about breakfast? Have you looked into data around lunch and dinner as well?
That is a great question. So I need to look at the data a little bit more, but my recollection is that there was not a question on the survey about lunch or dinner. There are a number of questions that are on the survey that we have not yet had a chance to analyze. So we are hoping to add more of those on an ongoing basis. But my recollection is that lunch and dinner were not actually asked about, although there were a number of other questions about nutrition and food that were asked. But this one seemed to capture to us was the best indicator of food insecurity that we found on the survey.
What is the age range for the Youth Risk Behavior Survey?
It is for students who are in high school.
Are graduation rates available? A district would be quite interested in that.
Graduation rates based on this data for the Youth Risk Behavior Survey are not available. However, graduation rates for homeless students in New York City are available in our Atlas of Student Homelessness, and they are broken out by school district. That is available on our website. If you have any questions about it, I'm happy to talk to you further. Just contact the information email at the end of the presentation.
Is there any current or pending legislation you would like us to be aware of regarding student homelessness? Anything regarding budget allocations for this issue?
So I think that is going to depend on where each person on this webinar is from, but I think that's a great question to explore further what legislation is taking place in your local community. And if there isn't any that's currently underway, how this information can be used to further ensure supports for homeless students. All right, this is all the time that we have for questions. As if there are further questions that anyone has, please reach out to us. We are very happy to respond to those questions offline via email or over the phone. And
email us at info@icphusa.org with any additional questions.
And with that in mind, I would like to invite all of you to save the date for April 20th, when we will be launching our next publication, The Dynamics of Family Homelessness in New York City, and also to save the date for January 10th through 12th of 2018 for ICPH's Beyond Housing Conference in New York City. Registration is now open, so please visit the website at the address shown on your screen. Thank you all so much for joining us. This is really exciting to see how much interest there has been in participating in this webinar. Have a wonderful day.